Welcome to EDTalks. And I have a friend, Jared Johnson. Jared, welcome to EDTalks.
Ed, so good to be here.
I know it's so good to catch up because I've been following you a long time and we've been friends for about 5 years, maybe a little bit longer. And I always consider you sort of the leader when it comes to experience and consumer experience and things like that. And you have this great podcast that people don't know about. I'm sure they do, called Healthcare Rap. But what I love about you, Jared, is like you're so honest and transparent and you call it out like it is. And you've been talking about these things for a long, long time, way before it was popular. And you got this great background, right? You worked at a children's hospital, you did marketing, but you also understand digital and the tech and how it all comes together. And you've been leading this whole wave, if you will, on experience. So I want to dive into it because you and I were chatting and, 5 years ago, we were thinking, all right, the wave is here and it's going to like, everyone gets it. And then we look 5 years back as like how much has really changed. And so what are your thoughts about that? Like, why are we slow to change, or are we slow to change? Maybe it's going faster than I know.
Well, I think there's a couple of ways to look at it, right? When we're talking about how are we addressing different aspects of the experience that a patient is having, and not just when they're a patient, we have the conversation all the time still. It may still happen through the end of time of when is somebody a patient? When are they a consumer? And I think I've learned to not get too caught up in what we're calling them because we have very different opinions about that part of it. But we can all agree that the experience is not where we want it to be. We're not giving people the digital experience in particular to those who are being served with healthcare in the ways that they demand and experience and expect and quite frankly deserve. So if you look back over the last few years, you can see an evolution. You can see talking points changing. You can see people at least approaching it differently and asking different questions. And they are saying which parts of this fit into kind of a human experience bucket and which parts fit into maybe a digital engagement or consumer experience bucket. And I think those conversations are refreshing. I think we're getting to a better place. Those have to happen before we kind of reach that critical mass where we're addressing it and approaching it in ways that patients are noticing, in mass. So I don't know if we're there yet, but you can definitely see some of those earlier indicators. Like you said, if is that the pace that we need to reach to experience the change that we need to in the industry? That could be up for debate.
Yeah. Yeah. I agree with you. I'm always kind of in a hurry. I know you are as well, because we sort of have this understanding about experience and it just takes a little while, right, for that wave to move along, for everyone to really grasp it. And I think it is funny that, sometimes I'll be speaking with health systems just like you do, and you'll say patient experience. I'll be like, well, it's not patients, it's consumer. And they're very adamant. And then the next health system, you say the word consumer and they're like, oh, they aren't consumers, they're our patients, But like you said, it doesn't matter, what we might call them. The fact is we all desire to have a better experience when it comes to our healthcare. So, that's at the end of the day, that's what it's all about. So you recently took a role. You are now the chief marketing officer of Priya Health. Tell us about that.
Ed, this has been such a good experience. I was really drawn to this company, not to put too fine a point on it, but Priya has been trying to solve some problems that every health system is trying to solve, and finally has a platform to enable some of this more exponential change that we were talking about when it comes to consumer experience, meaning there actually are things that are possible for health systems that haven't been in the past. My role has been to help educate the market on what that means. Priya Health is focused on a particular aspect of consumer engagement that we're referring to as experience orchestration. And I think that term is starting to gain ground. We're actually, as we've been looking at it, we're seeing the term more often. To us, what that means is that's the process of connecting all of the consumer's interactions with the health system. So that's before, during, and after their visits. Practice, when it's done right, it's based on actual data across an entire ecosystem about an individual. I mean, in our case, we will refer to them as a consumer because we're finding ways to engage them well beyond before and after their visit, as well as aspects of their visit itself. So we consider that a different type of personalization. It's not just marketing personalization or clinical personalization. It's orchestrating a lot of different point solutions that we, in a lot of different health systems across the country, just haven't even had the opportunity to kind of refer to in this way. So we're trying to help a lot of people understand what that term is, what the benefit is of orchestrating that experience, and how they can do that in new ways.
Yeah, I really like that term, orchestration, because you're right. A lot of health systems, historically, we've looked at experience as episodic experience, right? Only when they're actually within the walls of our organizations. And that's what's led to a lot of frustration with a lot of experience offices and things like that. It's like, how do we get the stickiness or what have you in terms of the patient? But you really have to broaden it. You have to look way before and develop that relationship before they ever need you. And not only during, obviously, but also after, like you were suggesting. So it's truly that whole orchestration. And I'm glad there's this platform that individuals or entities can look at and leverage to enable all that orchestration. Because that's also what's been missing in the past too. I think there's just been a lot of fragmentation. And so, I recall one time, Jared, I walked into a hospital and they met really well. And so I'm by no means making fun of them, but I just felt from a consumer point of view, I saw a big banner. It said, download this app, for, virtual visit. And then there was another banner about downloading another app. And it has actually 3 apps in total that you would need to have an experience. I'm like, man, from a consumer, I kind of into it, right? Because I'm sort of a techie person. I'd be super interested. But for the average person, that would make the experience less than ideal. And they probably wouldn't engage at that level.
Yeah, I think that's a perfect example, Ed. Another great example of kind of what's possible with experience orchestration is you can even think of something as simple and as universal as lab work. You can say you get your lab order. You've gone to see, you've had a primary care appointment maybe, and you've got a lab order. Now imagine if that, because you've logged in as a user to that health system app, that the app actually recognizes and can speak to the lab provider, like a LabCorp or a Quest, and have that notification pop up and say, hey, I saw you got your lab order. Do you want to schedule that now? And then not ask you to go download another app or create another login, but actually seamlessly without having to go anywhere else, have it pull up. You know what? I can connect to the scheduling platform that you've scheduled with before. It's not going to say that, but that's what it's doing. It's like, hey, I can see that data that Ed prefers scheduling on Thursdays at 2:00. That works with his schedule. So let's serve those appointments up first. And hey, do you want to schedule that right now? Here are the LabCorp facilities near you. Here's a map. Do you want to do that? But without having to take you to another app or create another login. That is a different type of experience that historically we haven't always been able to provide a patient or consumer. And so like that, it's a pretty universal way of kind of seeing what's possible.
Yeah, no, it makes total sense. So, Jared, I mentioned at the top that you have this great podcast. So if people are podcast listeners like I am, it's one of I have like 5 go-to podcasts, Healthcare Wrap. So as we wind down our chat and just catching up with one another, any wrap of wisdom that you have for us?
As a matter of fact, I can try a little. I guess this would be like a world premiere. I don't know. I don't want to set expectations too high here, but we can try something. I do have a little bit something about experience orchestration. We
I'd
can see how that
love
goes.
to feature it.
And I'm, by the way, flattered that's truly within one of your go-to podcasts that Healthcare App's in there. So thank you so much. But okay, yeah, it's early in the morning here in Phoenix, so I'm still waking up here, but I'm going to give this a little go. Let's see if we can add a little flow here too. Okay. If you could cause a tidal wave, if you could be brave, think of all the people you'd make happy and the costs you would save. You have so many point solutions that are disconnected. You know that there's a better way. It's time to get corrected. The trouble's always been that people make their health decisions in between all their appointments. It can feel like a collision. Keeping them engaged and not enraged means you have to step it up and personalize with precision. So here's the term. Ready? It's experience orchestration. It used to be the missing piece. Now it's a celebration. So let's all work together to get past the current state. Let's drive a new experience. It's time to orchestrate.
You heard it here
Right
first
there.
on Ed Talk. Wow, what a blessing. No, I love it. That's what it's all about. At the end of the day, man, we want people, they're going through a tough time in life. We all hit that moment with ourselves, friends and family. And it's great to have that kind of orchestration to help make the experience better. So, Jared, thanks for being my guest. It's always great catching up with you. I love the work that you've been doing and the pioneering. So thanks for being my guest.
Thanks so much, Ed. Let's do it again soon.
All right, perfect.